Pierre Poilievre is back on his bullshit.
We can't allow foreign criminals to take advantage of our system.
The Conservative leader says refugee claimants are undermining Canada's healthcare system. But as he's done before, Poilievre is misleading the public. Let's explore a few of his claims and compare them with facts compiled by the Migrant Rights Network. First, here's how Poilievre describes healthcare for refugee claimants.
Deluxe supplementary healthcare benefits for asylum claimants who've been rejected, who are non-Canadians, non-permanent residents, and have never paid taxes in this country.
Okay, a few things here. The care refugee claimants receive isn't deluxe. It's limited coverage similar to what many low-income Canadians get. If an asylum claim is rejected and the claimant receives a deportation order and exhausts all of their appeals, they lose access to the program. As for who pays taxes, that isn't determined by citizenship. Asylum seekers with jobs pay income taxes. Asylum seekers who buy goods pay sales taxes. We're off to a terrible start.
6 million Canadians can't get access to a family doctor.
This claim is true, and we've been talking about it in Canada for years, but it has nothing to do with refugee claimants. But you see how easily Poilievre takes a legitimate issue and then blames immigrants completely out of context? Poilievre also says the money that pays for the program in question is
money diverted away from our healthcare, jamming up our system and increasing our wait lines.
Not true. The federal interim health program is separate from provincial healthcare funding. But this lie is central to Poilievre's whole pitch. If he can convince Canadians that a refugee claimant's gain is their loss, then we end up blaming the most vulnerable instead of fighting for good healthcare for all. So, how would Poilievre provide healthcare to asylum seekers?
Those asylum claimants who are here and have been rejected only get life-saving emergency care and not special care.
Oh my God, how does he say it with a straight face? Life-saving emergency care is special care. It happens at a special place called an emergency room, which is paid for by the provinces. If we deny people what Poilievre calls special care today, they will lose their health and need more care in the future, which costs more money. And on that point, let's spare a thought for the Liberals and Prime Minister Mark Carney, who have already announced cuts to the program that Poilievre's Conservatives are now targeting. If there's a lesson we should have learned from the COVID-19 pandemic, it's that our health is a collective concern. It is Liberals and Conservatives who have chosen privatization and cuts over care. And the migrant scapegoating being used as a distraction, it's enough to make you sick.